Thank you, Marjorie, for sticking around because I have more questions for you. This one comes in from a viewer. It's about being on the pill. She's been on the pill for over a year. She says recently she began bleeding between periods, sometimes light, sometimes heavy. Is it something to worry about, or is this minor? What do you think?
It depends. So not every pill is for everyone. There are different types of pills. There are continuous pills. There are pills that have little different bits of medication every day. There are pills that have lower amounts of estrogen to progesterone. There are pills that are just progesterone only. Some of them are more prone to having spotting. We call it intermenstrual spotting. So between the periods you have spotting. Sometimes changing the pill that you're on, or identifying that there's some other kind of organic thing going on. So sometimes people get a polyp that grows in their uterus that causes intermenstrual spotting. Sometimes it's from a friable cervix, so a cervix that is, like, you know, when you have a scab and you pick at it and it bleeds easily. Some people's cervix is the inner part pokes out and it bleeds easily, especially after sex. So it's important to talk to your doctor about when it's happening so the doctor can figure out what kind of spotting it is and then whether it's related to the pill and it's an easy fix like changing the pill that you're on, or if something else needs to be investigated, you need an ultrasound and something needs to be taken out.
So definitely go back to your doctor.
Go back to your doctor and thinking
out.
about it, and especially at different ages being on the pill, and bleeding is not always a good sign. So you should have it investigated.
We get this question all the time. How can I tell if my child has a cold or allergies? What is the big distinction between the two?
So it's interesting because I have a kid that's really allergic to stuff except foods, but there's a period of the year in the spring where everything leaks and weeps and he's stuffy, runny, itchy, miserable, and so he gets, the kids have allergy medication too that you give him and he kind of manages through. But then all the rest of the year when something is going on, they start and you know it's coming. They get kind of tired looking and they start with the stuffy and then they feel not so good and they're like, Mom, I feel tired, and that is you're starting to get sick. And then they sneeze and it's not just the runny wet stuff that you get with the Kleenex you don't mind so much, it's the what color just came out of your nose stuff. That's cold and sickness. So those are the differences between allergies, thin, runny, mucusy, not a big deal, and cold, sick, slow, builds up, feels really cruddy, is interestingly colored.
Okay, and usually a cold is not itchy either, and often allergies are. There's an itchiness to it,
There's not
right?
so much itchy to cold. Cold is just misery.